You're a dancer?
I'm a dancer. I do ballet.
Competitive or recreational?
Both.
Okay. And so, as a ballet dancer, you've injured yourself, or did you have something else? What originally brought you to the office?
I got into a car accident a few years back, and I got reverse whiplash.
Okay. So you were hit from behind and you developed a whiplash?
Yes.
Okay. And you had seen other people prior to coming to this office, right?
Yes.
Okay. And then you found our office,
Yes.
and we saw you. We've been seeing you for how long now?
Oh, I don't know.
Over a year,
2.
I think. 2 years almost.
2 years, I think.
And we initially started working pretty intense with you to try to correct all the things that happened from the accident, remember?
Yeah.
So a lot of that stuff has been resolved, and because she's a dancer, she's high competitive and high recreational as well. She just loves it, it's her life. So through the process now is maintaining her so she can perform. I'm getting some heat swings, but not really a reading in your neck today. And you remember like a couple months ago, we actually went really aggressive on the neck. There was a
Yeah.
lot of stuff going on there, and I remember that one visit, we really had to go after it. Good news, lady.
Nothing.
Nothing in the neck today. So it looks like it's breaking there, but it doesn't. Okay, it was this overswing to there. So I want to do that again. The reading is down here, but there's a lot of heat. When we're looking at the break on the scope for nerve pressure, what we're looking for is a specific deflection back to 0. If it passes that midpoint and keeps going, it can do this. We're waiting for that clear break back to 0. So let's do that again. It goes left, it goes right, and it goes left again. Okay, so we're definitely going to focus on that area. And we got some going down in the sacrum right there. Sacrum, S1. That's S2. Tender there?
S2, yeah.
How about S3? S3 is also slightly tender, but S2.
is more.
S2. 7, 1. You can start to see with static palpation, all that's good. It starts to pool there. Right there. Right in there. Round your back some more, please do. There you go. So 7. 1, 2, 3, 4, 5, 6, 7, 8, 9. That's 10. That's 11. Starting to get a little crunchy in there. 11 is moving though. 10. That's it. That's the one. Dancers are very flexible, and with her it's at the very end range, so we got to go all the way to the end range before we actually feel that restriction. Okay, Sabrina? All right, so we're going to do 10, T10, S2. We're going to have you walk, and then we're going to work on the knees and ankles.
Okay.
How's that sound?
Yep.
Now, super flexible. We need to really isolate the joint. Super flexible, and we want to set it right there at the sacrum. That was a great miss. There you go. That's a piece.
My favorite one.
Let's put some paper here. Let's get a little more of the sacrum first here, and then have you walk, and then come back and do T10. So we're using knee chest table, knees back a little more. Again, super flexible. Her belly button may touch the floor. Let's see. Joking, but not. There we go. Good. A little more. There you go. Walk it off, please. Pretty cool. Keep walking. Walk up on your toes. Definitely got to work on your left ankle. Walk on your heels. Now for T10, okay, I'm going to use this strap here to stabilize your neck. We don't want to whiplash the neck, okay? There you go. 10. I'm going to set 10, thumb right on the spinous, using a thumb pisiform. Let's take it down all the way. There it is. Good. Good. A little more. Gotcha. Home run. So you're here to maintain the structural and neurological integrity of your body so you can dance at your best.
Yes, because tomorrow.
Is that correct?
Yep.
T10 is clear. S2 is clear. And looking at the presentation, you can see a slight external foot flare, but if you look at the femurs don't look rotated. You can see the rotation is actually coming here at the tibia. It's gone posterior on the external side. It's going to cause swelling and pain on the lateral meniscus, lateral capsule on the back side, and it is bulging. We're going to work on that today. Looking at this knee, it looks more here on the inside. So we're going to test it out as well. Tender in there?
That knee has been hurting the most, yeah.
Bulge isn't as bad on the back side. So we have an potential AIN femur on the right and a PEX tibia on the left. Let's do a valgus and varus stress. And it gaps kind of both ways. Opens on the outside, opens on the inside. When it opens on the inside though, it's clicking here on the medial side. We're going to set AIN femur.
Oh.
What?
And my knee has been clicking on the top on that one.
On this side? Yeah, we're going to check it right now, the valgus varus stress. So on this side, it actually doesn't even open up on the inside.
Oh.
It's fine. It's on the outside. So we're going to do AIN femur. To do the AIN femur, traction and hold on the tibia. We're going to place a thenar contact on the medial aspect of the joint, encompassing the whole thing. And it's going to be a straight set, medial to lateral, anterior to posterior, and a slight torque down. There, it's already starting to go. There you go. A little more. Gotcha. Let's use the board now.
Stubborn.
What's that?
Stubborn.
There you go. Okay, now the fun part. We're applying a little body butter on the lateral capsule, and we're going to need to work. Shall I call Jeanette for you? Are you okay?
Oh, no, I'm good.
Okay. So we've got to work that bulge back in. And the bulge is right there. Feel good there, Sabrina?
Yeah.
And I'm just working that capsule back in, lateral to medial and P to A. And what will happen is you start to feel that suck right back in. As soon as you do, that's where you're going to hold it in place, right there. I'm going to hold it in place, maintain traction. Bend the knee, please. Bend, bend. Still maintaining traction. Hold on to the table. Gotcha. Nice. Okay, now we're going to tape it. Elastic on tape. Taping in the direction of the adjustment just to hold it better. It used to be a lot more brutal,
Yeah.
right? Yeah. It's easier. Up on your toes. How's that feel in your knees?
Good.
Okay. Walk on your heels. Bring it down. There you go. Shoulder. Around, over, down. That's it. Ears. You. Ears. There you go. Let's set the elbows. Thumb. Wrist. Fingers.
Yay.
What's with the red, white, and blue?
They've been on there forever.
Oh. There you go. Squeeze. You're all set. All
Thank
good?
you.
You're welcome.